Hi, my name is Dr. Louise Oliver. I'm a GP, functional breathing practitioner, and a therapeutic life coach. Today, I'd like to discuss what I feel is a missing jigsaw piece in perimenopausal and menopausal care. Perimenopausal and menopausal information frequently discusses the effect of changing hormone levels on brain, skin, heart, bones, muscle, etc. However, the effect on breathing is often overlooked. Hormones affect how we breathe, and how we breathe affects our health and well-being. Breathing is generally an unconscious process. However, this does not mean it's automatically efficient. I'm promoting a 3A's approach: aware, assess, action. So aware, raising awareness of how breathing is altered by hormones, how this can lead to inefficient breathing and the symptoms of inefficient breathing. Assess, offering women an opportunity to assess their breathing efficiency. Action, encouraging and empowering women to improve their breathing efficiency. Breathing may be a large or a small piece in your perimenopausal or menopausal care jigsaw. I encourage you to continue to listen to this to find out more. Aware, women generally have a smaller airway, rib cage size, lung volume, and a shorter diaphragm than men. In addition, the movement of the ribs as we inhale is different in women compared to men. All these factors impact how easily air enters and leaves the female body. A large population-based study showed lung function declined more rapidly among perimenopausal and menopausal women. This decline was greater than the normal expected deterioration in lung function related to age. The study noticed the decline appeared to increase difficulties with breathing in compared to breathing out. It's known menopause causes muscle loss, but how often do we discuss muscle loss from the breathing muscles and encourage breathing muscle exercises to strengthen these muscles? Although the exact mechanism is not clear, studies have shown an increased risk of sleep-disordered breathing after the menopause. Sleep-disordered breathing, it's a spectrum. It ranges from just an increased resistance to the air passing through the upper airway whilst asleep, to snoring, to obstructive sleep apnea, which is when the airway actually collapses and causes a pause in breathing whilst asleep. The Wisconsin sleep cohort study demonstrated a 3.5 times risk of obstructive sleep apnea in postmenopausal women compared to premenopausal women. Women with obstructive sleep apnea are less likely to report snoring or witness gaps in breathing, but instead are more likely to complain of daytime fatigue, lack of energy, insomnia, morning headaches, mood disturbance, and nightmares compared to men. More research is needed in how hormonal changes affect breathing. However, it seems the female hormones generally have a protective effect on the airway and drive to breathe. It's thought the female hormones increase the tone of the upper airways muscles, preventing airway collapse during sleep. Therefore, the reduction in the female hormones after the menopause may be the reason why the upper airway is more likely to collapse or vibrate, and increases the risk of obstructive sleep apnea. Progesterone, which is one of our female hormones, acts as a powerful respiratory stimulant, which means it increases how fast the individual breathes. And it does this by increasing the body's response to low oxygen and high carbon dioxide levels. Now, this could help the airway open up, but conversely, the faster breathing rate could actually lead to sort of a vacuum effect, leading to airway collapse. Also, if the faster breathing rate leads to a reduction in carbon dioxide levels, it can trigger the body to have a pause in the breathing to allow the body to increase levels back to normal. Furthermore, the change in body fat distribution around the menopause can lead to an increased body mass index, waist circumference, neck circumference, and all these are associated with a higher severity of obstructive sleep apnea. With all these changes, the efficiency of breathing can deteriorate as women transition through to the menopause. I developed snoring in my perimenopause despite a healthy weight and running 3 times a week. HRT helped many of my symptoms, but it did not improve my snoring and my sleep. I improved my breathing efficiency, which stopped my snoring, improved my sleep, and made running easier. Assess. I want to give women an opportunity to assess their breathing. So what is effective breathing? Effective breathing is through the nose. It's slow, it's gentle. The exhale is longer than the inhale. There's a short pause after the exhale, and it's driven by the diaphragm. And that means the lower ribs expand sideways on the inhale. Over the next week, check in with your breath intermittently to assess whether it matches this description, including when you're distracted on the computer or watching the television. Breathing inefficiency or dysfunctional breathing lacks a rigorous definition and a clear method of assessment. Some researchers, so Keisel and colleagues, explored different assessment methods, and it led them to proposing a breathing screening procedure consisting of measuring a breath hold time and answering 4 questions. This does not diagnose dysfunctional breathing. However, it's a useful tool to indicate you may benefit from improving your breathing efficiency. So why would measuring the time you can hold your breath indicate inefficient breathing? At some point after you start holding your breath, your brain sends a signal to breathe. Frequently, individuals believe this is due to the oxygen levels dropping. However, this is not the case. By holding your breath, you stop breathing out carbon dioxide, so the level of carbon dioxide rise. There's enough oxygen in your lungs and blood to maintain oxygen levels during a breath hold of this type. You have receptors in your body that have a specific sensitivity to carbon dioxide that is personal to you. When the carbon dioxide level reaches your sensitivity level, your body will send a signal to breathe, and you'll feel air hunger, which is a feeling you either need to take in more air or you're not getting enough air into your body. It's best to check your breath hold time after waking and before eating. You make sure you sit upright and you keep your mouth closed throughout the measurement. You take a small silent breath in through your nose and a small silent breath out through your nose, and you hold your nose with your fingers to prevent air from entering your lungs. Use a stopwatch to record the number of seconds until you feel the first involuntary muscle spasm. So you will feel this as a contraction in the neck or the diaphragm, which is at the bottom of your ribs. And this is your brain sending a signal to your body to breathe as you've reached your carbon dioxide sensitivity level. We are testing comfortable breath hold time, not testing willpower. Therefore, your breathing should be calm afterwards. Now, there's 4 questions I'm going to ask now. And what we want to know is, do you notice any of these symptoms often or very often? So the first one, do you feel tense? Second one, do you feel a cold sensation in your hands or feet? The third one, do you notice yourself yawning? And the fourth one, do you notice breathing through your mouth at night? Now that might need to be assessed by another person. If you have a very dry mouth in the morning, noisy breathing or snoring, it may suggest that you're breathing through your mouth at night. If you scored less than 25 seconds and answered often or very often to one of the questions, I would encourage and empower you to take action to improve your breathing efficiency. Action. Improving breathing efficiency consists of 2 aspects. The first is ensuring the airway is open, strong, and it's combined with nasal breathing. The second is ensuring the amount of air an individual breathes matches what their body actually needs, that we're using the correct breathing muscles, and the speed of breathing results in synchrony between the heart and lungs. I run functional breathing programs for the perimenopausal and menopause. If you'd like more information, see my website, which is www.drlouiseolivertherapeuticlifecoaching.com/menopause.